I have the privilege of introducing someone else who's going to introduce Bob. So I like those. My good friend and colleague, Dr. Lucian Leap.
Good evening. It's a great privilege to have this role. I think one of the most encouraging thing about the patient safety movement, and something we need to think about when we get discouraged, is the success we've had in attracting people of outstanding talent and abilities to our field. And no one has contributed more than our speaker tonight, Bob Wachter. Bob distinguished himself early as a student at the University of Pennsylvania. He was an honors scholar, mortarboard. He then went to medical school there and was AOA, went out to University of California in San Francisco, and then went to Stanford as a Robert Wood Johnson clinical scholar, just like Tom did, and then came back on the staff of UCSF. But this was, he was at Stanford about 1990, 1992. 4 years later, he started a new field called hospital medicine. In 1996, he published a paper that established the concept and the definition of the hospitalist, a new specialty in medicine, especially that in the years since then has grown to 30,000 members. He has, of course, been the president of their society, and I think, frankly, more importantly, has edited the textbook in the field, The Hospitalist. So it was very interesting to see that Bob, at a relatively early age, made a huge impact, something that any of the rest of us would be quite happy as our life's work, to be honest. It was only 4 years later that he got interested, he actually got interested at that time in 96, but 4 years later that he came into our attention in the patient safety world, where ARC asked him to head up the project to evaluate the evidence behind safe practices. And he was the co-author of that publication called Safer Care. About the same time, he started Quality Grand Rounds in the Annals of Internal Medicine as a regular feature of presenting cases and the analysis. And shortly after that, ARC asked him to start the Web M&M, which he has run since then, which consists of each month presenting 3 cases that are problems in safety with an analysis of what we can learn from them and so forth. This website alone gets over 1 million visitors every year. ARC then asked him to do a second website, patient safety website, which also gets 1 million visits a year. Bob has done a lot of writing in his life, as you know from the biography in the program, and he's received many honors, many more than I can take time to list, although I can't help but say that I am really pleased that one of them is he has recently been elected to the Lucian Leap Institute, and we're just delighted to have him join us. But I suspect that the honor that means the most to him is the fact that year after year, he is awarded the Outstanding Teacher Award for residents and also the award for students. And as I know Bob, I'm sure that's the award that really means something to him and clearly richly deserved. I think what distinguishes Bob, for those of us who've had the opportunity to know him and read his work and so forth, is his ability to think clearly and express effectively the many issues in patient safety. He's written over 250 papers, 6 books, in addition to these websites that he runs for ARC, he has a blog, Wachter's World, for which he writes a 1,000-word essay every 10 days, and then all the discussion that comes from that. He has appeared hundreds of times, literally, on television and radio as a spokesperson for patient safety. So clearly he is a person that has done a tremendous amount for all of us in our work in terms of getting the public as well as the professions to understand what patient safety is about. In thinking about introducing him last night, I revisited his two books that I'm most familiar with, the Understanding Patient Safety, which many of you know is the textbook of patient safety, and really a model of clarity and comprehensiveness. Let me read to you what I wrote as a blurb for that book. In a single volume, Wachter accomplishes the seemingly impossible, furnishing the novice with a highly accessible, easy-to-read introduction to patient safety, while at the same time providing a comprehensive, fully annotated reference for the experienced patient safety practitioner. And indeed, it truly is a reference for our field. But his first book, Internal Bleeding, which has sold over 30,000 copies, is just as good, and if you haven't read it, I urge you to do so. I think better than anything I've read, it explains the heart and soul of patient safety, what it means for patients and what it means for providers, what the real world of patient safety is at the interaction between two human beings, which is where it all takes place. He leads us through a series of patient cases, which he then analyzes and discusses in a breezy yet penetrating analysis. Let me give you two quotes that will give you some of the flavor. It's as if we spent the last 30 years building a really souped up sports car, but barely a dime or a moment making sure it has bumpers, seat belts, and airbags. And then arguing for the systems approach. If we continue to focus on errors as individual screw-ups, as human failings to be managed with shaming and suing, the only way we can prevent mistakes is by redesigning the human condition. Compared to this divine intervention, creating new systems to prevent medical errors seems downright simple. Well, to make it simple for all of us, please welcome Bob Wachter.